Awareness Month, and more than 8 million people are living with the autoimmune skin disorder. We know psoriasis can be especially hard to live in, especially when it's 115 out. We know that the heat can make it really brutal, which is why we brought in an expert and a dermatologist to explain how to manage flare-ups in the summertime. We want to introduce you to Dr. Christopher Rex with Peak Dermatology. Good morning, and thanks for being here, Doc.
Thanks for having me, Kylie.
So first off, break down what psoriasis is. Some people have heard of it, right? But maybe haven't experienced it for themselves. Well,
psoriasis is a very, very debilitating disease. It affects about 7 million people in the United States. It's defined as a chronic inflammatory disorder. The way I like to describe it to my patients is the systems in your body that are usually used to fight off infections, for some reason they're just left turned on, causing these rashes on your scalp, elbows, and knees that can be very itchy and scaly.
So is it primarily scalp, knees, and elbows and stuff like that? That's where you usually can find it, things like this?
Exactly. Yeah. It can manifest very differently. Some individuals have very mild disease where it only affects their elbows, but some people can have at least 50 to 60% of their bodies covered by these plaques.
I mean, that just seems like so painful.
Painful, itchy, sometimes it really affects their quality of life because they feel very ashamed to go out. It's very embarrassing. So it not only affects them skin-wise, it affects them internally and it affects them emotionally.
Talk about some of the triggers. What can cause this?
Well, even though it's a autoimmune condition where we don't know why it gets triggered on the inside, things that could be the first things that manifest, like an infection, it could be stress, it could be the fact that they were on a medication that triggered it. We know that 80% of people who have psoriasis have some familiar trace to it, where someone else in their family. So we're still trying to figure out why, but we know kind of what triggers it.
Is it prevalent more in a certain population, or can kids have it? Can adults have it? Anybody?
Unfortunately, it affects male, female, all ages equally.
Yeah, and that can be really hard to deal with. If you have eczema, do you also have like a chance of an increased chance of having psoriasis?
We are studying currently the association between both disorders, even though they are different. Both have different kind of mutations, different kind of drop-offs of the proteins that cause them. So I've had patients who've had both. Pretty rare, thank goodness, but they're not correlated.
Okay, interesting. On your screen right now, we've got how to prevent a flare-up. So what are some of the things, maybe if we have psoriasis, what can we do to make it kind of dormant and not have it flare up this time of the year?
Well, this time of the year is very hot. So we know that heat and sweat kind of trigger the psoriasis. So using sunscreen to protect yourself. When the skin is dry, that can also trigger a flare-up. So moisturizing, I usually stress moisturizing, drinking water so you stay hydrated. So basically those kind of things. And if you have to walk out in the sun, I would say usually do it before 10 a.m. or after 4 p.m.
Is it something where it's kind of like can go dormant and then it can, like, you know, if we talk about flare-ups, you know, like maybe you don't have it for a couple of months and then boom, it's back in your life?
Exactly. Yeah. Since one of the triggers is stress, you can imagine sometimes when we have treated a patient, they get dormant, they don't have any breakouts, they feel like everything is gone, and then they get maybe stressed, or they get exposed to a particular bacteria, and all of a sudden they have a new flare. So it's really important to get connected with a good dermatologist so that you're on a particular treatment plan. Even though you may not be seeing the plaques, you're at least treating it in the dormant phase.
Yeah, you don't want to have to deal with that, right? Every day of your life. That can certainly be painful, hard, itchy, all of that. Dr. Christopher Rex with Peak Dermatology. You've got an office in Payson and Fountain Hills. We appreciate you joining us.
Thank you for having me,
Thanks so much for being on, and certainly an important topic as it is Psoriasis Awareness Month. We're going to